Hello, I'm Dr. Aerin Sembhi. I am an integrative women's health doctor, and I'm here speaking with Runjhun Pandit. She is a perinatal mental health specialist, and the topic of this conversation is perinatal eating disorders. And so I am going to just open up this conversation with to get some insight from you again on your background and what are the kind of the biggest things that you've seen as a mental health therapist in women who are struggling with eating disorders, either in the during pregnancy or postpartum.
Thank you so much, Dr. Aerin, for having me. And this is something that is really close to my heart. And I work with a lot of women who struggle perinatally and postpartum, just understanding the changes that their body makes and sort of like go from there. So I think the one thing that has in general come up is every mom or expecting parent feels that they are the only ones who are struggling with it, and they feel really lonely, and they feel like there's a lot of changes that nobody talks about as they are going through the pregnancy journey and the challenges of postpartum. So I'm hoping that this conversation opens up a safe space for those individuals to feel seen, heard, and I hope that this resonates with them as well.
Wonderful. So I'm curious, eating disorders can start at, very different times, right? So maybe someone has an eating disorder when they're younger. Have you seen eating disorders? Do they, happen mostly when people have issues in the past, or can they start, brand new during pregnancy or postpartum?
Great question. So it could be both ways. So eating disorders could have an impact on their mental health even before the whole pregnancy situation begins. It can also happen when they start noticing the changes in their body, and they start noticing that the idea of pregnancy or postpartum that they had in their mind, which is probably based on societal or cultural expectations, and they don't see their body that ways. That could also start. If not a full blown like diagnosable eating disorder, but disordered patterns of eating, which could be either restricting more than usual because when you're feeding or you're best breastfeeding, you obviously feel a lot more hunger. Also, as your body is going through the hormonal crash, you feel a lot of like I am hungry. You constantly feel hungry, and that could make some of them really nervous about the fact that, oh, like in the past I was never this hungry. And it's interesting, right? Like nobody talks about it when you're going through it. Everybody talks about like, oh, you take care of yourself and take care of the baby. And obviously these days they're checking in on their mental health, but more so often nobody talks about like exactly what changes happen within your body, how it differs from each individual. And so, oftentimes, when you notice, say, for example, this idea of bouncing back after delivery, coming into this phase of, oh, if I'm eating this much, how do I actually bounce back? Is there a specific time frame that I need to, based on what I've heard from Instagram stories or cultures or society in general? And so these patterns sort of end up a person to feel that they need to restrict more, or when there lack of sleep, there is higher level of stress involved as you're adjusting to the new normal, as I call it. It is bound for some people to also feel this urge to like I need to binge because I have a lot of emotions, I have a lot of frustrations, or I'm sleepless, and I feel like the only way to numb it is through eating. So you will see a pattern of disordered eating come up as the postpartum life comes in.
Yeah, I think that's so interesting, especially postpartum, because, it's very easy to feel like there's this lack of control, right? Like you have this new baby and everything is just revolves around other people oftentimes. And I think one of the ways that people can respond to that, and I felt this personally myself, is by controlling what you eat. Like, that's something that can feel like it is something that you can control when everything else might feel like it's spinning out of your hands. I'm curious if that's something that you've seen with your clients.
Yes, on some level, and also some of it is also a part where it is not planned as like something I can control, but a lot more in terms of I feel very disconnected. So
Mhm.
I want to feel some sort of grounding, some sort of connection. So
Mhm.
oftentimes, they might try to compensate with exercising or feeling like they need to um, amp up their routines to make sure that they get into a certain weight or certain size. Also, postpartum, it often shows up as like forgetting to eat. They you notice like they're skipping meals because they feel like their life is very chaotic.
Mhm.
So in order to numb those sort of emotions, they want to bring in different types of activities or different types of things to pause them from eating, stop them from like consuming a lot more. And I have seen that they feel, a lot of them also mention that uh, because there's so much focus on food and food intake postpartum, and
Mhm.
having the frequency with which you have to eat, or the choices around, like in a lot of cultures, like the choices around like what you should and shouldn't, like there are rules placed in postpartum that it starts to feel a little bit like that is also controlled. That
Mhm.
is also something that is not under their own emotions, not something that they can handle by themselves. And so
Mhm.
sometimes like they go into this complete denial too. So there is binging, but there's also like part which go into restrictions, like I don't want to eat any of this,
Mhm.
or I don't
Yeah.
like the taste of it, or I want to choose how or what I eat as I feed my child.
Yeah. I'm also curious your thoughts on, how this impacts or kind of relates to breastfeeding because, breastfeeding is a, very personal thing, this it's a postpartum, and just how the relationship with food can impact the breastfeeding duration and, just the whole experience of feeding the baby.
I love the fact that you said it is very, very personal, because it
Mhm.
is. It is something which is not, again, like not talked about in a way of like you don't have to feel guilty just because you don't
Mhm.
breastfeed. It's more about sitting with the idea that it is very attached to not only your stress levels, but
Mhm.
also the kind of food that you eat or
Mhm.
how much you eat. So, just recently, I was working with a client, and the one thing that came up frequently was, hey, I am super stressed. I'm not getting the sleep I need. I'm not getting the help that I need. And on top of it, like, I know I'm not making enough for my child. So, I am also feeling guilty. And then like we dropped into like the conversation of, okay, what do you eat the entire day? How much do you eat? I'm noticing like your mood is off. I noticed like you're trying to fix it by taking some medications. What's going on? And that's when we started realizing that there was limited knowledge around what should, not more like should, but what is good in terms of like feeding to not only increase the milk supply, but also working on your own health. There's a
Mhm.
lot of focus on like, hey, you have to take like these things to help with your supply, which could be herbal or more, in the South Asian culture, more from Ayurveda.
Mhm.
And at the same time, there is a concept of saying like, hey, let's eat towards your body, because your body needs to also heal. And when you are full, when you have eaten enough, that's when your body also has the energy to create
Mhm.
more supply for your child. So it's like a give and take relationship, which because people connect like eating a lot more to their weight gain, or in terms of how their shape would change. There's a lot of focus on like, oh, you have to eat like X amount of calories in a day, versus looking at like, can I take a minute, pause, reflect on what my body needs right now? Like, am I feeling hungry? And instead of looking at it as like, I'm just eating, can I mindfully curate a plan where I'm eating enough, I am feeding consistently, so that one, I'm able to support my body. Secondly,
Mhm.
I'm able to support my child. And in turn, I'm helping my body heal itself in order for all the other things that are coming up in life.
Yeah. I think that's so important because there's so much pressure on moms, even like 3 months, 6 months to bounce back. When we talk about this a lot. And so that just the expectations on someone who's just had a baby to be, whether, like back in their clothes or pre-pregnancy clothes, to be back to, to full-time work and be taking care of a baby. And then on top of that, if they want to breastfeed, it's just it's a huge demand on one person to be, doing all of those things. And I saw this really interesting study once that women who have eating disorders in the past are more likely to stop breastfeeding earlier than
Mhm.
someone who hasn't. I thought that was so fascinating because I haven't heard anybody talk about that. Never in any of my four pregnancies did anyone ask me if I had an eating disorder. And I personally, struggled with an eating disorder in like high school and college. And thankfully kind of, gone past that. But it's really easy to, have those issues flare up. Again, whether it's a new issue or it's something that, kind of comes back again after, these big changes in your body image and, all the, like you said, the just how hungry you get breastfeeding because your body is, it's a big demand on the body. Plus, like you mentioned, sleep issues. When we don't sleep well, we have interrupted sleep, or we're naturally going to crave more food. So it's really interesting how just all these little pieces come together and it can show up in different ways for different people and like impact things like breastfeeding, just how your supply, your interest, how long you want to continue. So there's just so many intricacies that I don't think we really get into enough at the
I think that's
6 week
the thing,
visit.
right? Yeah,
Mhm.
as you mentioned, like how long do you do it? How much do you do it? It almost feels like there isn't an option there.
Mhm.
It even though there is, it almost feels
Yes.
like if I say this out loud, it's going to be judged, and
Hmm.
people are going to make comments about it. Um,
Yeah.
and so it's almost like that is why a lot of women feel so isolated in this like experience in itself. That if
Hmm.
I am struggling to watch my body change, I mean, yes, in your mind, you're very aware and obviously you've read, so you know the body is going to change. But there's a
Hmm.
difference between like awareness and acceptance, right? And when
Hmm.
you real time see it changing, there's a lot of, I know a lot of clients would be like in a lot of denial that, oh, it won't, or like only this will happen, and if I do XYZ exercises then I will bounce back. And
Yeah.
it's not that you won't, or you can't, but at the same time, is there a definite need to have a time frame of when you want to look back? Just
Mhm.
recently, as you were sharing, the one thing that I had with one of my clients was they have worked on looking into options where they feel comfortable in their new clothes. So there
Mhm.
was a time where they were struggling with like, oh, I need to bounce back and I'm not like able to lose, or I'm not able to fit into my previous sizes. And there was a shift when we started talking about like, were the clothes made for us or were we made for the clothes? And so
Mhm.
we started talking of how body keeps changing for us, and we can either fight that change and not accept it, or we can move along and say, okay, this is the change right now.
Mhm.
These are all the demands. So, like, bringing in a lot of self compassion and then working from there. It's like, okay, I might eventually 3 years later have the strength and the ability to manage everything and
Mhm.
find time to, strengthen my body in different ways. And do I
Mhm.
really have to go back to the previous numbers or sizes
Mhm.
at a stipulated period of time?
Yeah. I mean, each pregnancy, even for the same person can be so different, based on, how the pregnancy went, based on your age, like having a baby when you're 20 is going to be different than when you're 40, right? And your recovery can be very different. Um, and maybe the 40 is easier because you were prepared for it, and you can still have very healthy pregnancies and recoveries, even as an older mom. But yeah, I think it's really important that you say just how there's no time frame. There's no specified time frame that in 45 days you should be here and in 90 days you should be here. It can be very a very big spectrum of what is right for you and what is, what is the right pace for you.
Yeah, I agree.
Yeah. Um, so what are some of the strategies that you use? You mentioned some things like, really looking at acceptance and compassion. What are some of the other strategies that you use to help moms who are struggling with postpartum eating disorders or um,
So one of the things that I mean, it's very commonly used in therapies like the CBT, but like cognitive behavioral therapy specifically for eating disorders. So we talk a lot more about like challenging the body rules, challenging like the body image thoughts, even tearing apart like where are these thoughts coming from? Are these some things that we have learned from our experiences? Is it coming from culture? Is it coming from society, family? What do they mean together? And then let's connect it to our own values. Like where do we, if I say I am um neutral, body neutral, and I really want to like focus on like the health of my body and health at every size, do
Mhm.
am I living up to those values? Is all of this conflicting, and that is why I feel stuck or I feel caught up? And along with it, there's a lot of like acceptance, therapy that we do in terms of like, let's focus on self-compassion. Let's focus on like building a lot more mental flexibility around not that I have to look XYZ by this time, but how much my body has been through, how much I'm actually putting in. So a lot of like looking at, as we say, like what would you tell your friend if they were going through this? Similar way, like treat yourself as your friend and like work from there and like build that compassion in to see that you've done a lot in this whole process. And then a lot of mindfulness work as well, which includes like focusing on the hunger, the fullness, focusing on like what your intuition or your gut says. Because
Mhm.
oftentimes, that gets caught up in like, oh, this is the time, so we should eat, or, I don't eat after this time, or we need to uh, only eat 3 meals. Versus, I remember when I was feeding, I would like consistently eat almost every 2 hours, and it would feel overwhelming at the beginning. And then it started to slow down with like, okay, I need it because I'm actually hungry. And when I am hungry and I'm not fulfilling that part of my body, I recognize that my emotions are running away and I'm feeling anger, frustration. If my kid isn't eating and they are also crying, they are mimicking my emotions. And it's like, it's a mess. Even as I'm saying it, I'm like, oh, I remember, I remember it was heavy. So
Yeah.
recognizing that it's important to listen to your own gut
Mhm.
as you're speaking and as you're like working through it. And then
Mhm.
changing some of the narratives, right? Like exploring the cultural pressures, exploring the identity shifts as well. Because like y- I think the pregnancy has its own story, but the
Mhm.
postpartum is a life where it's okay to grieve your past life. It's okay to grieve, like, oh, this looked very different. And now, along with the work life, along with like my personal life, there is this tag of I am a mom, I am a
Mhm.
parent. Like, this identity is huge. It's a
Mhm.
big, big aspect of your life.
Mhm.
And setting up expectations around motherhood as well. There's a
Mhm.
lot of like pressure coming in from family or like society of like how perfect or a good mom looks like. And I think these days, because of social media too, I notice like there's so much pressure on like, oh, make every day a nice, pretty lunches for your kids. I'm like, I don't think I have that kind of time. Like, and some days I really don't want to. Like, I just want to cook up
Yeah.
something which is fast, quick because I am
Yeah.
struggling, or I want to work out, or I want to do something for myself.
Mhm.
At the time. So I think like that's sort of like you can only be a good mom. Pressure can also feel very heavy. And so now you're living up to like these expectations which you don't even know what you're living up to. You're just like, oh,
Mhm.
if I make this, then I have to live up to like doing something else. And my house should look, I mean, I think that's the biggest thing, right? My house should look pretty clean and neat and pristine. And no, you are in your era, like you're in the mom era, you're in a parent era.
Mhm.
Letting go
Mhm.
of those things sometimes like really eases off the stress, and it helps you ground yourself and look at like what am I really doing here. I need
Mhm.
this time to connect with myself, with my family, with my kids, and go from there.
Yes. I think you're right on because it's so easy to lose yourself in the expectations to be taking care of everybody, for everyone else to be happy, for the house to be perfect, for you to be back, on track with work if you're, going that path or, having this perfect life. There's a lot of pressure. And when you for giving all day, it's really easy to try to compensate in different ways,
Mhm.
and to try to fill that, like, I'm not getting enough with, different, um, different things like eating or, other kind of ways to, get that fulfillment.
Yeah.
Um,
And
Go
I
ahead.
also like recommend new moms or moms in general to sometimes take support of like a nutritionist or a dietitian or like other providers to sort of help them ground themselves around like really what does food look like. Really like if I'm struggling with like creating this sense of friendship with food, how do I work with it? Because I think like we can sometimes rely on just like social media, like, oh, I think this diet is in and this is a fad, and I think like this works for me, versus okay, how do we create a more structured approach where consistency
Mhm.
matters than
Yes.
results.
Hmm. Absolutely. I want to go back to what you mentioned before about health at every size, because I think this is
Mhm.
something that, like, again, as you mentioned on social media, there's so much pressure that to, look skinny, right? And to like that health is being skinny. And speaking from my own experience, after my first baby, like I was vegetarian, long-term vegetarian before, well, up until my second baby.
Mhm.
Um, and because I was breastfeeding and my first baby had eczema and all these, tummy issues, I started cutting out more foods.
Mm.
And like I kept restricting things because I thought what I was eating was affecting my baby and I thought it was making him worse. And I lost a lot of weight and a part of me felt like, oh, this is great. But then I ended up getting really sick. I
Yep.
got Bell's palsy and I was just, I was pretty worn out at that point. And I think maybe that's another way that things can show up is like, you think that losing weight means being healthy, but there's so much more to it. And
Yes.
sometimes especially when we're breastfeeding, we might need to keep a little extra weight on so that our body knows that that things are safe, that there's enough food that we can also, support our baby through creating milk. I'm curious if
It
you've seen
also
anything
because
like
like your
that.
body is working extra too, right? In that
Mhm.
whole situation. And as you mentioned, absolutely right. Like there is so much, and I will say it's getting more and more to the point of like recognition that people realize that healthy does not mean skinny.
Mhm.
um, and there is still a lot more work to be done on that side, because there is still this like visual pressure, right? Of I need to be looking like someone, whether it's an influencer or Hollywood actors, and sort of looking at like, oh, they are this, and people appreciate it,
Mhm.
right? So I guess if I also look the same and I look skinny, then I will be healthy. And
Mhm.
people will look at me and appreciate, or and you also get that sort of like feedback from society,
Mhm.
unfortunately. Like you end up being skinny, if you say you restrict, you start recognizing that you get like these, wow, oh my God, you don't look postpartum. I think recently I'd heard someone like tell me that they kept getting this feedback from others, like, oh, you don't look postpartum. Wow, what are you doing? And she's like, I was really struggling internally because I have not been eating. I have not been like focusing on the right things for my body.
Mhm.
And so it was
Mhm.
like this conflicting message that they noticed. But health at every size is more of like what redefining what healthy means,
Mhm.
right? Like, hey, does healthy mean like I need to have the ability to go through the entire day without feeling like, oh, I'm just like exhausted at all times, or that I'm able to get through things. I'm able to sit down with my kid. I'm able to like run around with my child. I'm able to do things. Um, without worrying about, am I fatigued at every step? Am I, and I think like that is what the redefinition comes in. Like I can be skinny, but I might not actually be able to even go through the entire day without having to like rest 2 times, 3 times if needed. Versus like when you are healthy, healthy could mean like you're fueling your body correctly, whether it is not just like eating high fat meals, but more so like let's focus more on the right nutrition, the right portions that are needed. And that's why I feel sometimes having a structured approach using a nutritionist, dietitians can help you give like a realistic picture. Like, okay, this is what you eat culturally, and this is what has helped your body. Let's
Mhm.
focus how we can get the right calories and the right intake so that you are supported throughout the day.
Mhm. That's great. Is there anything else that you see commonly postpartum that you want to share?
I think the one thing is definitely about how friends and family could support a lot more.
Mhm.
Um, I mean, I know it's said more often, but not making comments about someone's body as they have like given birth, whether it is 10 months postpartum, a year, just sort of like asking them how they are doing. um,
Mhm.
or even say, when they are looking for like supporting them, actually asking like, hey, what food should we bring over, or how can we help, in terms of like, do you want me to take care of your child as you're eating your food? Because oftentimes too, right, like they feel it's guilty if the child is crying, like I shouldn't be eating, I just like forget about it. It's like, okay, I'm going to take care of your kid while you need to eat. Or let's do this, like let's make it easy, let's celebrate how far you have come. So I think like these supportive aspects really help them, rather than giving them the stress of like, oh, house needs to be clean, or you need to do your laundry well, or all of those things. So I definitely feel like, we talk about the village, I think it's important for us to be a really good villager as well, if we want the village to be there for us.
Yeah, I think that's so true. Having and also being open to have people come and help. I think that's one of the hardest. It's unexpectedly hard sometimes. Is again because there's this pressure that I should be able to do all this. I should be able to take care of my baby and recover and take care of the house and go back to work and all these things. And it almost feels sometimes like if you have to ask for help, it's because you can't do it all, which no one, no
Fun.
one can, no one can. So, I love that you're talking about that, just kind of advice for friends and family and anyone kind of in the support network, to ask what they need, ask how they're doing, ask what they need, and come and help, whether it's with the dishes, whether it's with the laundry, whether it's, cleaning up or bringing meals or bringing over any kind of food. I think it can be a completely different experience to have a baby and have that kind of support than to try to do it all on your own.
Yeah, I think like that just makes things less complicated and helps them
Mhm.
focus on themselves, which they definitely need in order to function later
Yeah.
on.
Yeah. Yeah. Well, wonderful. It's been such a pleasure to talk with you. And any last words to share?
No, I think thank you so much for having this conversation. As you rightly said, like we don't talk enough about these things. We don't express how important it is to, look at your own eating and your own like food intake as you go through like the perinatal and postpartum phase. So thank you so much for like bringing that, and it was a pleasure talking to you as well.
Yes. And I'm curious if there's any resources that you would recommend to someone who was interested in getting help with, eating disorder or concerns about their eating
So
postpartum.
there is a registry of National Alliance of Eating Disorders. So I would definitely look into that because they do have like registered dietitians and therapists who work specifically with people struggling with eating disorders. And I highly stress on that because oftentimes like we think that everybody knows about how to deal with it, but this is a very specialized and nuanced way of where there is a non-judgmental approach that's taken on and focused more on supporting you. So I really love that resource, just to sort of look at and like get help from.
Yes. Wonderful. Well, we'll share that link along with this video.
Absolutely. Thank you so much.
Wonderful. Thank you, Ranjan.